Are you listening? Damn.
Hi, okay, I just wanted to show you some things that I'm using. So what inspired me to come to my, I have Urkel pants on and I'm 600 pounds in that window. Anyways, so yes, hair has grown back in my armpits, pretty thick in the right one, not so thick in the left one. And I'm not gonna get like a regular razor in there, that's frightening. And so I got this one and it's chic, is that how you say it? It's like $13, but it has this, it's like a bikini trimmer, but it fits, it's so little. And it fits like perfectly in the little area where hair is growing. So last night was the first night and you just push a button. Like you control it. It was the first night that I got to shave these beasts. It's nothing perfect, it's not smooth, but I mean, we're back down to tiny, tiny hair. So it works for me. So just in case you need an idea, they do have these. I got this on Amazon. I'm sure you can get it plenty of other places. So this is, I'm gonna show you this is the spray that I got in Mexico. It's what they use on you after surgery. And then I just sent the valet to get it for me there. I just got one bottle. It was $15 and it's lasted me this entire time. I use it every day. There's not gonna be any order. This is Biocornium Advanced Scar Treatment. So it's tiny. I thought it'd be much bigger, but this is not gonna last me very long, especially if I have these incisions all over. So you just put this silicone gel on any of your areas that are all the way closed, any of your scars that are all the way closed to help their appearance. You massage it in. I think I've shown this before, but just in case I haven't. This is the antibiotic cream that they send you home with from the hospital. I think it's great. I had to use it on my armpits the day after travel and helped like a dream. I used it in my belly button a few times. When I was still having problem with the leaking, he did tell me to get like an antifungal cream. I never used it. I got it off of Amazon, $4. He called it ketoconazole cream, maybe. This is just a knockoff brand. So an antifungal. He didn't really know what was going on with my belly button. I think it was that stitch in there that we cut out. It was spitting, and so now it's closed now and I haven't had any drainage for 2 days. He did have me get a wound cream to put in there that like draws out infection. And so I just have a little bit of it that we put, I don't have the bottle, I just have a little thing of it that we put on a Q-tip and put up in there. And then I got this box of gauze pads and I cut them into 4s. So right now I have 2, but tonight I'll cut this off and shove it in my belly button. And I usually have tape in there, but since I changed to this new faja, well, okay, I was able just to like push the gauze up into my belly button and then put the faja on and everything stayed. But this is the sensitive, I don't have a box for it, but sensitive tape, and this is my 3rd one I've gone through. And then I just got this in the mail today. Sika tape. I thought this would be a lot bigger. It was like $17. Look at it. It's like not like the size of my cheek. And I need to read the directions, but that's what it looks like on the inside. Same concept as that gel. It goes on spots that are already closed up good to, it says, apply directly to healed wounds where scar tissue is formed. I don't know. It's very small. I don't know how long that will last me. I'll let you know though. And then I had this, I have a very deep belly button. If I haven't said that on here, which I'm sure I have. But every time I get out of the shower, I hold this little fan. It's like one that I had to hook onto a stroller, like when we'd go to the zoos and it'd be hot. And I just hold it up to my belly button like this to make sure that it gets real dry up in there so it wasn't moist up there and not letting things heal. I needed it to be very dried out. So for like 10 minutes, I would just stand here and let my belly button dry out. I also have used, my arm's getting tired, Aquaphor I've talked about, and it went down below that little spot below my belly button that they called it a vent. because my skin was pulled so tight and I was like trying to suck in my belly and all that to help heal that. Aquaphor. And then I have some vitamin E oil, which you can also put on your scars, but right now I'm just putting it on my nipples, which are or like my areola, because it's just for the dry skin, and I know that vitamin E oil will be fine with the scars, so just putting it on my nipples to try to get some moisture back into that area. Morning, guys. So I just want to go over something with you. I don't want it to seem like it's just all rainbows and butterflies over here. It's weird lighting, so it looks like I have a really tan face. I don't. Just the weird lighting of the window I'm standing in front of. Anyways, I don't want it to seem like it's just rainbows and butterflies over here. Although my healing in this process has been pretty easy. I've talked a little bit about like constantly worrying about something. Like the first few weeks was like, ooh, everything's great. And then I think reality starts to set in and you're just like, oh no, what if this happens? What if this is happening? And it's just scary. And then like all my stuff is healing really well. The scars look really great. I haven't had any issues really with like stitches spitting, just a couple. So for the most part, it has been great. But right now, the thing that's really bothering me, and my husband just keeps telling me, you always tell everybody just trust the process. And I know that's really hard to do. It's not reality most of the time. Like he said, just stop worrying. And I'm like, how do you stop worrying? So my stomach, I've talked about the bloating that I have in it, is still bloated or swollen or whatever you want to call it. And I think if I didn't have other people to compare it to, I wouldn't even know any better. I would just be like, oh, it's swollen because I just had this big surgery. But to me, I see other people that already have flat stomachs that are, you know, only a day out, a couple weeks out, and their stomach is already flat. And I see people that are at the same stage as me and their stomachs are flat. And maybe that's how it's supposed to be. And maybe it's just different for me. When I talked to the doctor about it, you know, he's like, just keep wearing your compression, take it easy, like it will go down. In my head, I'm like, why isn't it already down? It's been 6 weeks, that's long enough. And I just keep putting tighter and tighter compression on it. And even though it goes down a little bit sometimes, it's still there. From the front, you can't tell at all, but when I turn to the side, it's just not flat like I imagined to be. There's still like a pooch there, and not like a fat pooch. Like it's hard, and it's something I worry about. And in my head, I was like, no matter how any of these surgeries turn out, like it's better than what it was before. So I don't have anything hanging anymore. I've never looked like this in my life. It's just like scary. It's like people expect you that you had this tummy tuck, that, you know, if someone told me they had a tummy tuck and then I saw them, I would expect their stomach to be flat. And I'm not one to normally care what others think, but I was so hyped up about like, oh, maybe I'm going to get to wear a bikini for the first time in my life. But like, honestly, as my stomach looks right now, I don't want to wear a bikini. Well, I do, but I don't, because I don't want people to be like, why does she still have this pouch? I don't want people to be like, oh, she shouldn't have gone to Mexico and got that surgery. You know, I realize that 6 weeks out from a major surgery maybe isn't that far, but it seems like far to me. And when I can compare to other people, it makes me in a little bit of a panic. And then it gets me thinking like, maybe he should have done lipo on my stomach. Maybe I should have got the FDL. But then I'm like, Megan, your stomach didn't even look like this before surgery. Like it was not puffed out like this. And so then you just start thinking like, is something wrong? What if the swelling never goes down? What if, and I'm constantly like, honestly, always pushing on my stomach right there. Like right now I got into that smaller compression that I was telling you guys about without the faja underneath. And I've got lipo right there on my belly. So I can't ever see, and I have lipo in the back too. That's why it looks pushed out here. Because also what I found out about fajas that no one had told me about was, yeah, you can keep putting on tighter fajas, and it was like pulling my back. Like it was making it where I couldn't even breathe because the back was pulling so tight on my sides in the back. And it was like making wrinkles in the back, and it just was super uncomfortable. So then I was doing some research on some fajas, and I saw that people were putting lipofoam on their back so it couldn't pull their back so much. And I don't really know how to explain it, but it made sense to me. I'm like, oh, obviously if I put lipofoam in the back where it's pulling really hard on my back, then it will give it more resistance in the front, and maybe we can even things out. So I have 2 lipofoam on my back on the sides, and then 1 right like above my belly button and on my belly button area, 1 folded up in there, just right there. But all of this feels flat. Like this is where my scar is, and it goes down to my mons area. So all that feels flat. It's just like right here, and I don't know how to get that out of there. But I have seen a little bit of improvement, and it's just maybe me not being patient. But there are things you worry about, and it's not perfect, and I'm not perfect. And so I just keep thinking, well, maybe in 6 months, I'll just look back and laugh at this. Like, haha, remember when you just thought your stomach was going to be swollen? But then the devil on this side is just like, maybe something's wrong. Maybe you should have done something different. Maybe. And I keep thinking like, maybe you're sitting up too much and it's like squishing it and it's making it that way. And there's just not any real instruction of what to do. So I try to like reach out to my November girls surgery and like, hey, like, what does your day look like? Are you sitting up? Are you laying down? How are you positioning yourself? And I mean, it's been a mix. People are like, yeah, I'm sitting up all day and it's fine. And of course, I haven't seen any of their bellies, but they also haven't complained at all. So I don't know. It's hard. It's really hard. But I just wanted to keep you up. I just wanted to keep it real with you guys and let you know, like, it's not perfect. And it's by far better than anything I could have ever imagined. And I can't wait until I can dance and shake my butt without anything flapping on the front, and overall doing really good. But it's just those little worries that I wanted to let you know, if you experience them too, like, you're not alone. Hey guys, so today is my, well, first of all, I was able to get dressed. So as long as I have a shirt on that's like stretchy, I can lift it over my head and get it on pretty easily. Sometimes I need help taking them off, but I'm getting there. I continue to work on my range of motion, and so I was able to do these buns in my hair. I can now reach, you know, like both up there and really make a style out of it, curl my hair. I'm showing progress every day in that. Today is my first day without my sleeves on that they gave me. I just have the shirt is like kind of tighter to help me feel more comfortable. The doctor actually never told me when to stop wearing them, but with my husband's help, I decided just to go for it last night. So no problems so far. I woke up fine. I've been using them today and it's been fine. I did mention last week in my email to the doctor that I was still wearing my sleeves, and he never acknowledged it. And then this week when I sent it, he never acknowledged the sleeves either. So I am going on to 7 weeks post-op, and I figure it's time. I didn't really figure it. I feel more comfortable, but like I said, with my husband's coaxing and telling me just try it, I did it. I still have my band on. I usually wear it overnight, and then throughout the day I give myself a break in the afternoon because it does tend to rub my armpits, but it feels good right now, so I'm going to keep it on. I'm trying to stay far back from the camera. I do have the biggest cold sore I've ever had in my life on the top of my lip here, so if you can see that and you think maybe I got lip injections, I didn't. It's just a giant cold sore on my lip, so there's that. I'm gonna kind of look back at my emails and see what me and the doctor have talked about the past couple of weeks. So this week when I sent in my photos of my body, the doctor said everything looks like it's healing really well. So I would just check in once a month instead of once a week now, unless of course I had questions, then I could email him anytime. He told me I would be using my silicone gel treatment for 2 to 3 months out, just until the scars have flattened and faded. But the thing is like this big and it's pretty expensive. So I'll probably only use it until it runs out, and then I'm probably not going to buy anymore because I don't, like I've told you guys before, I don't care about the scars. Like that's not a concern of mine at all. So I'll just use that. And I did get that silicone tape, which I've showed you guys, like came in a box this big. So that's not going to last me anytime. And it was scary to take off. I had it across my back and it felt fine like while I had it on, but then it was not comfortable to peel off. And I mean, I'll probably use it in some areas just because it was expensive and I bought it, but I won't use it until my gel is out. That's all he really had to say. I am still using the antibiotic spray that I got from them. I asked him in my last email, like, do I need to keep using this on my incisions every day? But he did not answer that. So communication with them through email takes a little bit of a time. Of course, none of this is like urgent and emergency. I do wish that he would thoroughly read the emails. It's Dr. Sanchez that you talk to back and forth. I do wish he would read his emails more thoroughly, so then after I've waited days for an answer, he would answer everything. He did not answer whether I still need to use the spray or not, so I'll probably just use it until it's gone because it doesn't hurt anything. I did ask him if I need to be stuffing my belly button with anything. The drainage is gone. There's no issues with the belly button anymore. And I do have like a perfect little circle. So he said you only have to stuff your belly button with something, you know, like it looks like it's concaving. Is that the word? Where it looks like it's not going to be a circle. And he said with me that's not the case. It is a circle. Just because I want to, I'm going to keep putting a little ball of gauze in it just to make sure nothing happens. I do have the little earphones that people put in there, but I accidentally pushed one too far the other day and it was uncomfortable and it frightened me. So I'm staying away from those right now and just sticking. I have a bunch of gauze pads, so I just ball them up and put them in there with a little piece, sometimes with a little piece of tape, sometimes not, and do it that way. I was wearing, I'm gonna try to get up, my knees are hurting me. I have been wearing my faja without any foam in it. I did have foam here and foam in my back because it creases in my back so bad and pushes in right there so much. So sometimes I put foam in there to stop that. But yesterday I did get bloated from Christmas for sure. So I just have a little piece of lipofoam right here above my belly button. I don't like, whenever you put, I'm gonna try to squat. Or no, maybe stand. Whenever you put the lipofoam across your scar, which my scar is clear down here, it like indents where the lipofoam stops, and I don't want it to mess with my scar. So so my scar is here, the lipofoam's clear up here so it doesn't touch any of my scar. I did read the other day where people had used like lipofoam and foam boards excessively and it made them like lumpy, and I don't know if it eventually like worked out, but some people didn't like the after effects of using it, so I've just tried to tone down using it and just let the faja do its job. I can't pull the faja up myself. It's pretty tight and I don't want it to get stuck on my hip scars. Even though they're closed, I just don't like them to be touched, and it's really hard to pull up. So I don't want to strain my arms. So my husband does help me get it on. Last night was the first night I was, I'm going to say able, but I never really tried until last night. I was able to take off my sleeves, my bra, and my faja all by myself, get in the shower, do the entire shower, blow dry, put everything on I needed, except he did put the gel across my back. And then he did help me, like I said, get my faja on, but I was able to work the bra up my arm. So every day just trying to do things more independently. Like I said, on Christmas, I did indulge in all the snacks and all the sweets. So I woke up feeling super swollen, like even in my hands, like you could just tell I just overate. So this week, reeling it back in with as little salt as possible, drinking as much water as I can, going back to yogurt for breakfast, tuna for lunch, and some healthy alternative for dinner, and of course having protein bars in between there. I have just a couple more weeks until I get back to work. I'm cleared for everything. I'm cleared where I have no restrictions. for work. I believe January 11th will be my first day back in the office, and so I've got to learn to get dressed, and I've got to learn to get on regular pants because I live in sweatpants and leggings, because I haven't tried to put any pressure on my belly yet with regular pants. I did get some gift cards and some different clothes for Christmas, so I'm excited to eventually be able to put them on. I'll try to maybe next video do like scar updates and incision updates and just show you what everything looks like. It's hard, obviously. I can't show you what my boobs look like, but I can show you hopefully around them or as close to them as I can, but just kind of hard where everything is placed. So my arms are amazing, like not red, perfect lines, no issues, no openings. They've been wonderful. So hopefully everything else will continue to heal that way too.